Good morning, everyone. Today's session is going to be really helpful and it's led by Dr. Rima. She's going to talk about something all soon to be parents and their families should know, the early signs that show when labor is about to begin. Now, this information isn't just for the expectant moms, it's for everyone who cares about them. So, stick around until the end because you'll want to learn this. Let's not keep you waiting any longer. Dr. Rima, you have the stage.
Yeah, thank you, Shivani. Hi everyone. I'm Dr. Reema Agarwal from Apollo Cradle Hospital in Indrapuram. I welcome you all in this very interesting session. All the would-be mothers in the ninth month, they are mostly apprehensive about how the labor will begin. How will we know about what's going to happen? हमें कैसे समझ में आएगा कि अब पेन शुरू हो गया है और हमें आना है हॉस्पिटल. So these are very frequent observations and concerns of the patient which we come in day to day practice. So आज हम इसी के बारे में बात करेंगे. What is labor? Actually पूरा 9 महीने प्रेगनेंसी में हम करते हैं. एंड व्हाट डज लेबर मीन? लेबर इज एक्चुअली द प्रोसेस ऑफ गिविंग चाइल्ड बर्थ. तो इसमें इट हैज 2-3 कंपोनेंट्स which is like painful contractions, then discharge per vaginum, and sometimes the patient can have leaking, bleeding. It involves the contraction of the uterus followed by opening of the mouth of the uterus and allow the passage of baby through the canal and having ending up into a delivery. So labor ये होता है. Now labor, the whole 9, it can start anytime during the pregnancy, but usually it should be happening in the ninth month. So all the would be moms, parents, you have to focus, especially in the ninth month. If you have any of these signs which indicate कि labor start हो रहा है या हो चुका है, so around 36 weeks, the patient can experience lightening. Firstly, lightening means baby has moved slightly down, थोड़ा सा नीचे खिसक जाता है. तो वी ऑलवेज टेल द पेशेंट कि ये ध्यान रखो कि ऊपर का हिस्सा थोड़ा खाली लगे. यू फील द बेबी हैज गॉन डाउन, ज़्यादा मूवमेंट हुआ, किसी दिन थोड़ा हल्का लगने लगा. So that can be one earliest sign that labor is now going to start. This is called lightening in medical term. So lightening means shifting of the baby slightly downwards, like the head is entering the pelvis. So that is one thing. Another is dull lower abdominal pain, backache. The patient को हर समय heaviness, pain, pelvic pain होता रहता है. Then the increased frequency of urination. सडनली आपको बार बार यूरिन जा रहे हो, फ्रीक्वेंट हो रहा है, यू ऑलवेज फील अ प्रेशर ऑन योर ब्लैडर. दिस इज अगेन in the ninth month when the head has come down and it is pressing on the bladder. So frequent urge to pass urine is there. So these are very early signs. Like इससे ये होता है कि now anytime the patient can go into labor but not actual labor has started. Then some patient has very erratic signs like increase or decreased fetal movement, and sometimes they come with increased frequency of motion also, and always having a pressure कि motion भी pass करना है बार बार. But what are the actual signs? In which case you have to report to the hospital and your doctor. They are painful contractions. First and most important sign is painful contractions. These will be like you have a wave of pain starting from your back, your lower belly, pressure of urine, pressure of motion, and then it lasts for few seconds to few minutes and then it will pass off. The characteristic of labor pain is that it is not prolonged, it is not continuous in nature. It is uh, आया and गया. मतलब it will come in waves of contraction कि आएगा फिर 1 घंटे 2 घंटे कुछ नहीं, फिर वापस 5 minutes के लिए आया फिर चला गया. So ये जो आता जाते वाला पेन है ये मोस्टली लेबर को करता है इंडिकेट. जो कांस्टेंट डल एकिंग पेन है दैट कैन बी ड्यू टू मस्कुलर पेन, बोन पेन, या जस्ट pelvic pain. So if you have that kind of pain कि जिसके साथ the uterus become tense, belly becomes bloated, you feel heavy tightening of the stomach with pain, and it goes off and you are relieved for next 2-3 hours and कुछ नहीं हो रहा, and then again the same thing happens, that is one of the characteristic of labor pain. Secondly, very important is blood mixed discharge. It is called show in medical term. Blood mixed discharge is supposed to be the sure sign of labor. This means your cervical mucus plug has come out and the cervix is opening. So, what is cervix? Cervix is the lowermost part of the uterus. It is also called the mouth of the uterus. बच्चेदानी का मुंह जो एक आम भाषा में बोला जाता है. So, that is cervix. So, opening of cervix lead to passage of mucus plug. So, initially the patient may have some increased vaginal discharge. The patient will say that I am having slightly increased discharge. पहले भी आता था लेकिन अब ज़्यादा आ रहा है. So that is one thing. And then if it is blood tinged या bloody discharge, so that means cervix का mouth open होने लगा है. Uterus का mouth open हो रहा है. Cervix is started to dilate. So this is a sure sign of labor. You have to report to the hospital in this case. इस पे घर पे नहीं बैठना. And third thing is, some patients come with discharge of discharge like of watery discharge from the vagina. This is called leaking. Leaking means suddenly like urine pass ho gaya. You feel like you have passed urine in your clothes. It is water breakage. This is again a sign of labor, but it can happen any time during pregnancy. Sometimes it happens in seventh month, eighth month, with or without pain. This can happen with pain or without pain. So, but you have to report to the hospital and your doctor. So, these three things: painful contractions, passage of discharge, which may or may not be blood mix, and leakage of water. These are very important signs which you have to look for, especially in your last trimester, and then you have to inform and reach the hospital. Uh, Otherwise, slight increase and decrease in activity of the movements. If there is decreased activity, like you haven't felt baby moving in last 6 7 hours, then also this is important, and you have to go to the hospital to check up out the fetal well-being. So most of the patients are very apprehensive about how the process starts, how we will go, when to report, and false labor pains are also very common. They are also called Braxton Hicks contraction, in which there is slight pain, slight tightening, and they are like when the lower segment is being formed, so uterus is getting irritable. It is not associated with any discharge, it is not associated with leaking, watery discharge, and otherwise the patient is comfortable. Sometimes there is just tightening. So these are also pretty common, but you should report to the hospital, go to the doctor, because raising a false alarm is better rather than sitting at home and you don't know what is happening. So labor usually involves all these, any of this sign, three signs which I have told you, any of this can come first. There is no fixed chronology like पहले पेन होगा, फिर वाटर डिस्चार्ज होगा, फिर ये होगा. कोई सा भी तीनों में से पहले हो सकता है. And you don't need to worry about it in any way, because all this is natural. So this is a natural thing. Uh, it is by some hormonal changes, some changes in the internal system of the uterus, which causes whichever will come first can happen. And from there onward, we know that yes, you have to go ahead and get the patient delivered now. And we can start with the lightning thing. In the lightning, the baby, if you feel the baby has shifted down, you can expect that the labor may start in next 1 week to 2 weeks. So that is a good sign of going into labor. Then if you have leaking, the labor can start in next 1 to 2 days, but you have to go report and see whether the water which is coming is clear, or is it stained with baby spotty, or any other mishappening is there. So all these signs have to be seen. So I would like to ask the viewers if they have any questions regarding this. Are there any questions from the viewers? If anybody wants to know. So I hope that this information had been useful to all of you. And if you have still have any questions and you have joined late, you can put in the chat box and I would be able to answer you in the chat message. Uh, so stay safe and healthy and don't worry. Everything is a natural process, labor and delivery. Don't get worked up about it. And all the best to you all. Bye.